All right, thank you for joining us. My name is Selena Dorme. I'm from the Tsleil-Waututh Nation here in North Vancouver and the Engagement Coordinator for the First Nations Public Service Secretariat. We are back with another information sharing webinar. This webinar specifically is to provide information and answer questions specific to First Nations Child and Family Services in BC during this pandemic going on with COVID-19. So we do have a few speakers that I'm going to introduce. They're going to chat just for a few minutes. Like I said, most of the time will be allocated to answering your questions. I think we're here for about an hour or an hour and a half. So there's a lot of time. You can go ahead and start submitting your questions right now if they're burning inside of you. From the Leadership Council, we have Cheryl Casimer with the First Nations Summit. From the Ministry of Children and Family Development, we have Allison Bond, Deputy Minister Allison Bond, and from Indigenous Services Canada, we have Regional Director General for the ISK-BC region, Catherine Lappe. I'm going to go ahead and hand it over to Cheryl to begin speaking. Thanks so much.
Thanks, Selena. Okay, so good afternoon, everyone. As been mentioned, I'm Cheryl Casimer with the First Nations Summit and the Leadership Council. I'm coming live to you from Carrier-Sakani traditional territory, and so I just want to give acknowledgements to Carrier-Sakani for allowing me to be a guest on their territory, on their lands, and to do this important work. I also want to thank representatives from ISK and MCFD for taking the time to be with us on this webinar, and most importantly, to acknowledge your participation for being with us, knowing how busy everyone is dealing with and working with our children and our families and wanting to ensure their safety as we go through these unprecedented times with COVID-19. I just wanted to let you know that the Leadership Council has been working diligently in terms of maintaining contact and communications with multi-ministries, multi-agencies during this period, almost daily, it seems, where we're working with First Nations Health Authority, the Health Council, ISK, MCFD, the Representative for Children and Youth, Minister of Health, and numerous ministers from MIR, Education, as well as FNLC, the FNSA, and we've even had participation from representatives from tourism. And so today is an opportunity that is as a result of a request put forward by the Leadership Council to create this virtual space for frontline workers, leadership in communities who were not affiliated with delegated agencies, to have an opportunity to receive information from representatives from ISK and MCFD, as well as an opportunity to ask some questions in terms of what resourcing, what supports are available for you at this time to work towards keeping children and families safe in our respective communities. So I thank you for the opportunity to address you, but more importantly, I'm looking forward to hearing the dialogue. And if there's any way that the Leadership Council can continue to lobby and advocate on your behalf, that's what we're here for. So thank you again.
Great, thank you. Deputy Minister Allison, over to you.
Thank you. Hi, everybody, and thank you so much for hosting this call. We're really happy to be here, and I'm speaking to you from Lekwungen Speaking Territory in Victoria. And yeah, this is a pretty unusual time. We're all faced with, I think, an extraordinary amount of uncertainty, both when it comes to our children and families, but also our work, our social lives, our economic lives, and this is making things very, very complex. So what we've been doing in the ministry is working really, really hard to maintain services, continuity of services. So we've got all of our offices open. We are providing services. We're working in collaboration with DAAs, and I know no one on here is served by a DAA, but that's something that's been really important for us, is to continue to have a really tight collaboration and relationship. We're making sure that our social workers are still on the job. We've had to adapt, obviously, some of our services to accommodate the orders of the provincial health officer and social distancing. We're also working with our service providers who provide a ton of the services for you in your communities, and making sure that they're able to maintain continuity of service as well. So that was our job one, is keeping offices open, keeping services being provided, especially now. This is when our services are so needed across the province. And for those of you who aren't as familiar, I mean, MCFD provides child welfare services for sure, but also mental health and special needs services. So we have a full suite of services for families. We have put in place some emergency supports. We made an announcement today. We put in some supports for youth aging out. I know Canada has done that as well. And we're going to be continuing to monitor and adapt our services based on what's happening every day. It changes every day for all of us. We get new information, we understand what's needed, and we make adaptations as we go, and it's so important. But one thing we're not changing is our commitment to the implementation of the federal legislation and act respecting First Nations, Inuit, and Métis children, youth, and families. That hasn't changed. We are maintaining our commitment to helping Indigenous families stay together, to reduce the number of Indigenous children and youth in care, to support families, and now with new complications around physical distancing to continue to do that work. So that has not changed. Our commitment to collaboration around jurisdiction has not changed. And we have been listening to and hearing from First Nation leaders about the challenges you're facing, about some of the unique challenges you're facing based on where your communities are, and we're continuing to pay attention to that. So as the pandemic situation evolves, as your needs evolve, as things change, our daily task is figuring out how to meet those challenges and do it in a way that helps us provide supports and services to children, youth, and families. So I have a whole huge bunch of people here with me today because we weren't sure what clients were gonna, what questions would come up. So we really hope that we're gonna be able to answer all of your questions to the extent that we know the answers, and sometimes we just don't because it's also very new. But I want you to know that, you know, if you can see how many of us are here, we're here because the challenges that you're facing and the other children, youth, and families we serve are facing are top of mind for us, and will stay that way. So thank you very much, everyone, for your attention today and for joining us and asking questions. And I'll turn it back to you, Chair.
I'm running the show and I don't unmute myself. Go ahead, Catherine.
Wasn't sure whether I should out you, Selena. Good afternoon. I'm Catherine Lappe. I'm the Regional Director General for Indigenous Services Canada and BC, and would like to start by acknowledging that at this time when we work at home, I'm very fortunate to be able to do my work from the traditional and unceded territory of the Squamish Nation, and very privileged to be able to do so. My thanks also to the First Nations Public Service Secretariat, who has developed a new line of business, which is to host all these various webinars in this time of crisis, because it is an effective means of us in real time sharing information, and also providing a record of the discussion so that others can watch it after the fact and join in the conversation or join in the sharing of information. I also want to thank the First Leadership Council, who have put these issues at the forefront every time that we meet, and suggested that we have this discussion with the 82 now communities that continue to be served by the Ministry of Child and Family Development, to make sure that information that's not always tailored can in fact be tailored for you, and that we can answer your specific questions about the situation for children and families during this unsettling time. Some of you may have joined the seminar we had last week, and I apologize that about half of you were not able to join, where we did an overview of some of the supports that are in place by Indigenous Services Canada. Just in brief, I would note that we've got people working all across the Easter weekend to in fact process amendments so that we can get the Indigenous Community Support Funding out to your communities. We sent you a letter a few weeks ago which identified the allocation that would be available for 2021, and we are now in the process of putting those amendments through and sending them to you over the weekend. So hopefully you'll be able to receive them and send them back so that we can get you the funding in the next few weeks. I would note that with respects to health services and health supplies, I would ask you to connect with the First Nations Health Authority on that. They will be getting additional resources from Indigenous Services Canada to ensure the preparedness and support to First Nations communities across the province, and are better connected to the supply lines and experts that can answer your questions in that area. And we are working very closely with them as we support you during this pandemic. We've, in other sessions as well, had education rise to the forefront of every discussion, as obviously people are very concerned about supporting kids as they don't go to school and are trying to learn online now. And I can tell you, as a mother of a child who keeps popping in here needing help, that it is really a challenging task. And it's not just about the technology, but there are a whole bunch of social, mental health, curriculum, technology, and various other consideration that need to be taken into account as kids try and stay connected with their classes and moving forward. And in our conversation with FNLC, they are working on supporting on-reserve schools and delivering distance and online education and how to support those kids with the needed technology. And of course, provincial schools are working on connecting families to deliver coursework and trying to address where there are vulnerabilities in the system and where there are special needs. So hopefully we can collectively support all of our kids in making that successful transition. With regards to child and family services, delegated Aboriginal agencies have been provided with a new set of eligible expenses that will support them in their service delivery during the pandemic. This is to ensure the health and safety of their staff and the families and communities they work with, as Allison was mentioning earlier. You may have also seen this list of eligible costs as it was communicated in an email that I sent out to all communities last week. I do want to clarify that those costs are for delegated Aboriginal agencies specifically. In the cases of your communities, because the Ministry of Child and Family Development is providing you with these services, the Ministry, of course, will also be covered for the same level of service to support the health and safety of your communities. And as Allison mentioned earlier, you know, there is a hold on the aging out of kids in care, and we have also committed to matching that until at least the end of September, and we'll review that as the situation unfolds. But because you are not affiliated with a delegated Aboriginal agency, I wanted to just confirm that your communities will continue to receive the allocations that you have the last few years under the Community Wellbeing and Jurisdiction Initiatives. And so those are already loaded in your agreements for this fiscal year. As you know, these funds are intended for prevention-based community activities. They're not pandemic related, but we certainly appreciate that the pandemic creates a different set of risks and pressures for families, and so prevention activities may in fact look differently and cover families in a different way under these circumstances. I also want to touch on the implementation of the Act respecting First Nations, Inuit, and Métis children, youth, and families. This Act, as you will well know, came into force on January 1st, and many First Nations are, in BC in particular, are interested in the implementation of the jurisdiction components. I want to assure you that ISC has been focused on providing continuity of all essential services at this moment, but obviously non-essential services like travel and engagement will be reduced to reflect and respect the directions of communities as well as the realities of the broader pandemic and the risks that it presents to all of us. So despite the outbreak, supporting Indigenous communities as they develop Indigenous-led and controlled child and family services system remains a priority for ISC. And I understand that many meetings are still taking place via Zoom and other technologies to ensure that the momentum is not lost during this period. We recognize that Indigenous partners and communities, as well as provinces and territories, are interested in this continued discussion and engagement surrounding the implementation of the Act, and I can assure you that we will be there every step of the way. As departmental resources in the regions may be restrained due to the pandemic, communities and groups are encouraged to communicate with regions and headquarters to have important discussions concerning the exercising of the jurisdiction under the Act. We are adapting to the current public health recommendations around physical distancing and utilizing different platforms. We will continue to take concrete actions and steps to keep Indigenous children with their families and connected to their communities and culture. And I just wanted to note that apart from Kiara Taylor, our Director of Child and Family Services Reform, who's on the line, and a number of our managers, we also have Natalie Neptune, who's the Director General of Child and Family Services based in our headquarters, as well as Christina Reed, who's the Executive Director of Jordan's Principal, on the line, so that we can answer questions for you in that regard. I appreciate that people may have specific questions with regards to Jordan's Principal, and I just want to assure you as well that that is one of the critical services that we have prioritized for continuity of services. We have a full team working on it, as we did previously. So my thanks to you all for being here, and we look forward to hearing from you and your questions. Thank you.
Thank you so much. Cheryl, I noticed you came back online with your video. Is there anything you'd like to add before we move on to questions?
I think I'm good at this time. I just, I forgot to mention that as part of the Child and Family File, the Leadership Council has 3 leads per se. I'm one of them, and Regional Chief Terry Teegee and Gookby Judy Wilson are the other 2. And I understand that they're also online. And so, and there may be other members of the Leadership Council as well that I'm not fully aware of, but this is definitely an important issue for us to make sure that communities have the supports and resourcing made available to them to carry out the important work in community. And so that's why we requested this session, as well as we're going to be participants in terms of listening in to make sure if there's any follow-up necessary on our end that we're prepared to do it. So that's it. Thanks.
Great. Thank you so much. We're going to go ahead and move on to the questions. We actually only have 2 questions submitted so far, so please continue to do that on an ongoing basis. Like I said, we have about an hour to answer those questions, so use that Q&A button at the bottom of your screen to submit those there. The first question is for MCFD. Can those of us with MCFD contracts repurpose some of our funding to support the growing issue of food security of our vulnerable clients? Funds we would use for food programs, can we distribute to families as long as we follow public health orders and universal precautions? I'm hearing different things from local MCFD offices in this regard.
Thanks. Yeah, so I'm not sure if Rob is available. No, he's not on Zoom yet. So what I'll do is I'll take a crack at it, but I think actually ISK may have some information on food programs as well. I'm looking over at Catherine to see if she's nodding. She doesn't appear to be. She's looking at her phone. No, she's just smiling prettily. So what I will say is this. In terms of service continuity, we have maintained the funding for all of our contractors. So if you're in receipt of a contract with us, you will continue to be paid under that contract, under the terms of the contract. What we're asking for is for people to retool their services so they can provide the services we contracted for in different ways. So we've heard from lots of contractors who are doing, who are able to deliver their services using physical distancing, for example, and so on. So there are other programs federally and provincially around food security, which probably will continue to change. This is not something that we're expecting to fund under our contracts. What we want is for you and others to continue to provide the services that are so important, those social services right now that are so important to our children, youth, and families. So just doing that, though, taking the appropriate precautions consistent with the provincial health officer. That's what we've been looking for. We have had lots of success, lots of virtual work, etc. But food distribution is not one of the things that MCFD typically funds. And I'll go backwards and see whether or not we can do some follow-up on other provincial programming that's supporting food programs for rural, remote, and other communities. But Catherine, has ISK got anything on the go around food programming?
Yeah, so we are talking to the provincial ministries on this as well, because there are efforts underway to ensure that the supply chain is unaffected. And I think throughout the province, at different times, we are experiencing shortages in some areas, but there is work underway to ensure that communities are well served. And on a case-by-case basis, we can also work with individual communities, particularly those that are remote fly-in or barge-in, where there may be some disruption disruption in services. There is, though, when you're talking about sort of kids at risk here, the ability under the Indigenous Community Support Fund to address some of that, use some of that funding for at-risk families, elders, and other vulnerable populations. So hopefully that's a support that will address some of it. And, you know, I mentioned earlier that we were talking to FNLC and so on. I think this is where, you know, we can also sort of work across different program areas to see if there were before lunch programs that sort of address some of the kids that were in need of lunches and so on. Is there a way of retooling or recreating that and combining it with other sort of community supports or delivery of food that's occurring in some communities? You will likely also know that social assistance, for instance, has been enhanced by the province, and we're mirroring it on reserve. So there was a first set of enhancements that occurred very early on during the onset of the pandemic. And then just a few days ago, the province confirmed that there would be a $300 a month increase in social assistance, and that will be mirrored on reserve as well. So we're trying to get to some of the systemic issues that will allow families to continue to support themselves during this situation.
Thank you so much, both of you. The next question is for ISK. Our nation was in discussion to proceed with jurisdiction under the new federal legislation. COVID-19 response in community is our primary consideration, but can we or should we still submit our own plan? We assume the timeframes will be altered, but we don't want to lose sight of this important initiative and our long-term important goals.
Yeah, so thanks for that question. I think I somewhat addressed it in the opening comments, but I would say that whether it's jurisdiction or capital projects or other initiatives that are going on, we're really taking our direction and our pace from you and what you think your community is able to manage at this point in time, appreciating that in some communities are self-isolating and so on. So as I mentioned earlier, there are meetings ongoing. They're obviously not in person at this point in time, but people are using technology to continue to have jurisdiction table meetings. And if you're able to submit your work plans, that's terrific. Because, you know, many people are continuing to work from home. And so if you're able to do that, we'll certainly be there. And I think I speak for MCFD as well, who I know have been coming to the table where jurisdiction discussions have continued. So as far as we're concerned, this is part of delivering an essential service, which is support to children and family. And we'll continue to be there with you at the pace that you and your community would like to set.
Great, thank you so much. The next question is for our caregivers. Do we have the ability to increase support for respite funding as they are now caregiving 24/7 in lockdown and don't have breaks such as schools and daycares?
Thanks. Yeah, I'm going to actually get Joanne White to come online, and she can introduce herself and answer that question.
Hi, everyone. It's Joanne White. I'm speaking to you from the traditional territory of the Lappe Dene people in Quesnel, and good to be gathered in a circle with you today. With respect to respite for caregivers, we are continuing to support respite and relief for caregivers as they need that to support the continuity of care for the children and youth that they have placed with them. If there's a need for additional support or service in relation to the current circumstances, certainly what we would do is encourage them to reach out and talk to their social workers so that we're well positioned to explore any necessary additional supports and services to enable the caring to continue. Thank you.
Thank you. Thank you, Joanne.
You're welcome.
There was a question submitted in the chat to ask for Allison to follow up directly. So I think their team will connect with you who wanted to specifically connect with them offline afterwards.
Yep, that's fine.
There's a follow-up question in regard to food security. So just to clarify, in regard to my question about food security, our nation has a contract for off-reserve services, and this program serves all residents in our area, including non-Indigenous families. I'm happy we are doing virtual services to provide the critical services needed. However, a key support that families relied on was the food provided in our programs. So we're hoping that we can use that unused part of our budget to provide the same service to the same clients who also need the food. We're seeing food costs escalating in our isolated area.
Yeah, thanks. And that's Dean Wilson, I see. So I think that's probably going to get more complicated and is very specific to the terms of your contract, Dean. So my suggestion is going to be, Rob, you're on the call, that we get somebody from Rob's shop to follow up. So somebody sort of more senior than your local contract manager. Because we're probably going to have to, this is one of those ones where it's an unusual situation and we haven't had to deal with it before. So I think we're probably going to have to sort it out directly with you and then have that applied generally. So let's get Rob, I know that you're on. Rob, maybe we can get some contact information from, oops, disappeared, is it Dean? And see if we can't get an answer to that question. I mean, what I can tell you is the original answer, which is that we can't, what we're looking for is the continuity of service. What Dean is saying is that part of that service used to include delivering or giving food, for example, at their, I assume, at their sessions and so on. So I get that. So it's more complicated than it would certainly appear at first. So I think we need to have more of a conversation about that and see what if any, flexibility we can afford, but also connecting in with other parts of the provincial government that are actually looking very much at issues around food and food security. We see that as an issue province-wide that's creating significant vulnerability for some families. So I think we're going to have to follow up on that one.
Yeah, and Allison, Rob online now. So I have taken that away as something that we'll look into and figure out what's happening there.
Thank you, Rob, and Allison for promising to follow up. If we do happen to not be able to cover all the questions during this hour and a half that we've allocated, all the panelists that are kind of working in the back end, all those team members have agreed to follow up with those people individually to answer any questions we don't get around to answering, and or ones that need a little bit more discussion around. Cheryl, anything you want to add?
Yeah, I just wanted to add a couple of things from the last two comments and questions that were provided. The first one in terms of respite. I know that we're in unprecedented times, and so we're really needing to look at different ways of how we continue to provide supports and services to families, even though we have to maintain a level of social distancing. And I just think that there needs to be a lot more flexibility from the funders, MCFD and ISC, in terms of allowing communities to be flexible and come up with different ways of doing things, because we don't have the ability to take children out of homes now and put them somewhere else. I mean, if respite can be provided by somebody who's in the home just to give the parent or the caregiver a break, then so be it. We should be thinking of those outside of the box type scenarios, and they should be fully funded and supported. In terms of the food security question, particularly if it's something that has been an ongoing practice in community, such as Dean's question, I know that Allison and Rob made a commitment to take it away, but I think from a Leadership Council perspective, that whatever innovative ideas that come forward by First Nation communities should be given serious consideration for implementation and continued support of funding. Those are my comments. Thank you.
And Selena, if I might just responding to Cheryl's comment, because I was just sort of thinking about this in the context of Jordan's principle as well. We're actually seeing a reduction in requests, particularly for things like specialized services and respite care and so on, because the providers just aren't available, to Cheryl's point. And so I think we do need to give some consideration for how those issues get addressed, particularly as it goes on for a longer period of time. And I did mention earlier that we have Christina Reed on the line, and I don't know, Christina, if you wanted to say anything about sort of respite care and what you're seeing across the country and what are some approaches that could work effectively in these circumstances.
Hi there, I'm Christina Reed. I'm the Executive Director of Jordan's Principal, calling from Ottawa. I'm a member of Mohawk Bay of Quinte, Tyne-Tenega. So thanks, Catherine. So we have seen a decrease overall. However, we are readily available to take requests for respite. So if there's a situation where your family is struggling and there's an unmet need for your child in need, we're open to taking that on. So please submit your request to the regions and they'll assess accordingly. Thank you.
Thank you, Christina. All right, I'm going to move on to the next question. Are there any funds for PPE for frontline workers, either through provincial or the federal government?
Thanks. Actually, we'll start and then I'll pitch to you if that's okay, Catherine. And I know there are two issues, obviously, with PPE. One is funding, but even more important one right now is supply. And for that, I'm going to actually ask Teresa Dobmeyer, who's the Assistant Deputy Minister of Service Delivery, to respond to that. She's actually currently our Director of our Ministry Operations Center during the emergency, and so she's part of a group that's talking about that right now. Teresa?
Thanks, Allison. Hi, everyone. It's Teresa Dobmeyer calling in from the Lekwungen-speaking People's Territory. Both the Health Emergency Operating Center and the Provincial Emergency Coordination Center are working on getting PPE and trying to make a coordinated effort around that. There is a supplies working group. First Nations Health Authority is linked in and bringing forward the needs for PPE in community.
Thank you. Catherine, anything you want to add to that question?
Not really. I mean, in this context, it's the Ministry of Child and Family Development that are providing the services to your communities, but certainly, as was just mentioned, the First Nations Health Authority has been reaching out to communities and First Nations organizations to see what the needs are around personal protective equipment and trying to address those issues. I saw our minister tweeting today about how many orders have been filled for getting PPE and supplies, sanitizers, various things out to communities. So it certainly is a priority. It's a priority for the government writ large, since there's, if you've been following the news, you would have seen that there's a huge demand for things such as masks, ventilators, and various other supplies along the way. And so there is a tremendous amount of work happening. And if people do have concerns, I would suggest that you connect in with Shannon McDonald and FNHA on those. There was a workbook that they sent out a while ago when they were asking for an identification of needs, including sort of supports around isolation, quarantine, personal protective equipment, and other supplies. So I would encourage you to connect with them on those, as they're very much integrated into the provincial health system, but also in with the federal side of things in terms of getting those supplies.
Thank you, Catherine. I'm going to move on to the next question. We have quite a few parents having difficulties reaching an agreement on visitation during this physical distancing time. Do you have any advice for how we as supports can explain to families what their rights are as primary caregivers, recommendations for joint guardianship and visitation with families right now?
Yeah, so for that, I think I'll ask the Provincial Director of Child Welfare, Corey Hebner, to come on and answer that question. Go ahead, Corey.
Good afternoon, everyone. My name is Corey Hebner. I'm calling in from the traditional territory of the Lekwungen-speaking people, situated in Victoria. And thank you for this question. Maintaining contact with children in youth and care, maintaining contact with their families is critical at any time, and even more critical during this time. And it was back now, I believe, around March the 26th, that when we were looking at the guidance and the recommendations that were coming forward from the provincial health officer, a decision was made at that time that we would pause on in-person visits and continue visits through virtual means. So I'm going to get back to that in a second. I also want to say that it's important to remember that there are exceptions. And so anytime that you feel that there is a need for someone in your community, a family member or a child and youth, to have in-person contact, that information has to be brought forward, and we will look at each of those circumstances. So I just want to be really clear on the exceptions. We also have made a commitment that we will review this at the very outset in 30 days. But I can honestly tell you, we are reviewing it every day, sometimes a couple times a day, around the direction that we've given on the pause. And I just want to say that that decision was not made lightly. And we do know and can appreciate the effects that that has on children, on their families, and on their communities. If you're having difficulty, it's really critical that you have someone to speak to. We can provide a name. I mean, I always say go to your social worker first, the team leader, the director of operations in that area. If that's not working, you can definitely come through to the Provincial Director of Child Welfare's office. I'd be happy to take those situations and ensure that they are dealt with and that we have the right people that are looking at them. And I just want to leave this part by saying that we, as I said, we're looking at it daily, and we'll make sure if there are any updates that you get them right away.
Thank you, Corey. Appreciate the answer. The next question is, what are MCFD's call out procedures during the pandemic?
Heather, I'm just seeing if I can see Karen on the Zoom, Karen Blackman, and I'm hoping she can hear me because I can't seem to reach her on Skype. So if she doesn't come off mute, what I'm going to do is just hold on that. We can go to the next one and hopefully we can find her.
I've just...
Oh, there she is. Her. Oh, no.
I'm off. I'm just learning new technology. So
did you get the question, Karen?
Yes, I did. I've been looking at the question tab. I don't know if I'm on camera. Anyways, I have to work on my Zoom skills. My name's Karen Blackman, and I'm acting ADM for Service Delivery Division, covering for Teresa while she's responsible for the MOC, our Emergency Operations Center. So in terms of call out, we have social workers on call in communities throughout the province to deal with emergencies. So that would be 24 hours a day. We would expect if there is an urgent situation, social workers are available on call. We definitely have a bit different procedures than we normally do. Whenever possible, we are trying to contact families beforehand to determine if anyone in the house is ill, or there's any potential of COVID-19. We have also been very clear with our staff that if they are sick in any way, that they should not be on the work site. We also have instructed our staff to really practice physical distancing. And so they've been instructed around the importance of that. We have been able to maintain our ability to respond to calls. We have some rural communities that are isolated that have requested that we really work with the band or with Chief and Council on how to enter those communities safely, because there's concerns about spread of the virus. So that's being done at a community by community basis at a local level. So if you do have any concerns about social workers being in your community, you can contact your local director of operations or executive director of service, and they will work with you to ensure that we can still maintain child safety while also really respecting the concerns of the community. And so we've really been able to work quite collaboratively with a number of nations around ensuring that any visits are done in as low risk as manner as possible.
Thank you so much, Karen. There is only one other question so far to answer, so please continue to submit your questions. We still have a decent amount of time. There has been a contact email also listed in the group chat to follow up with MCFD. A few of you have asked to connect offline. But at the moment, we don't have any other additional questions. So now is the time. I mean, really, where else can you get 20 people sitting around waiting to answer your questions?
what do you think about, I've got Emily Horton on the line, who's done a fair bit of work on the youth and some of the youth programming associated with the pandemic. Would there be value in us perhaps giving you a bit of information about that?
Yes, definitely.
And then after she's done, I'll ask Danielle Smith to talk a little bit about our CYSN stuff that we announced today. Go ahead, Emily.
Hi, I'm Emily Horton with the Ministry of Children and Family Development. I'm here working from my home office on the traditional territory of the Lekwungen speaking people. So I'll just provide a really brief overview of some of the emergency measures that have been put in place to support youth and young adults who are in care or transitioning out of care during this pandemic time. So the overarching objective of the emergency measures is to ensure that no youth is faced with having to transition to a level of independence and find housing and employment, etc., during such uncertain times. And so the first sort of emergency measure that's been put in place is to support youth who are in foster care, perhaps in a contracted residential agency or home environment, or living with extended family or community members under an out of care arrangement or an extended family program. And the emergency measure has allowed for those agreements and those caregiving agreements to be extended, well modified, but extended beyond the youth's 19th birthday, so that youth can stay where they are and continue to be provided room and board and support during this pandemic time. Another group that we are supporting through some emergency measures is youth who are living more independently before the age of 19, but are under the independent living agreements or youth agreements, and we've received support from the government and others to extend those arrangements with youth beyond their 19th birthday. So those youth will see no break in their payments and will continue to receive support during this time. Another group that we are keen to find opportunities to support are young adults who have left care, but have transitioned to the AYA program, Agreements with Young Adults program. And so, as you know, that program exists to support young adults who were previously in care, but are now participating in life skills programming or post-secondary programming or rehabilitation programming. Those youth, young adults, receive monthly supports from the ministry for living expenses, etc., while they're attending their school or other programming. Those young adults who have experienced a significant disruption to their lives, their programs have been halted in many cases, and there's a lot of uncertainty for those young adults about if they're going to continue to receive support. And so we are able, through policy, to continue to provide the monthly payments to those young adults on the AYA program, despite the interruptions to their education programming, and work is being done right now to ensure that they're not negatively impacted over the long term and are not seeing a decrease in the maximum duration of support under that program. And the last emergency measure I'll speak about at a high level is we know that there are young people who have left the system of care or supports in recent months who are particularly at risk of some of the broader impacts of this pandemic crisis. And work is being done right now to connect with young adults who recently aged out of care over the last number of months, and connect them with a range of supports and explore options for them going forward through the either the Agreements with Young Adults program or through other provincial supports that exist, because we know that they're particularly vulnerable at this time. So those are some of the youth measures that exist, and I'm sure my practice colleagues on the phone can jump in and answer any questions around what that means in terms of implementation or practice.
Great, and I still see no questions, so maybe I could turn it over to Danielle to talk a little bit about some of the CYSN actions that we've announced today. Would that be okay? Seeing a smile, I'm going to say go, yeah. Danielle.
Can you hear me?
Sorry about that.
Yeah, that's okay. Yeah, good afternoon, everyone. My name is Danielle Smith, and I work with the ministry as well. We've been undertaking quite a bit of work recently and announced today some interim measures to support families raising children and youth with special needs during this pandemic period. So as you would probably agree, many of these families are facing even greater complexity given the unique circumstances of their children. So we have put into place, which was announced today, providing a new emergency relief support fund and added some additional flexibility for parents around some of the policy parameters in the utilization of some of the supports and services that are offered. So just a little bit about the Emergency Relief Support Fund. So this is intended for children and youth with special needs and their families who are currently eligible for children and youth with special needs services, but also currently waiting to receive those services. And so this Emergency Relief Support Fund will provide a direct payment of $225 per month to eligible families over the next 3 months. And using a needs-based approach, the funding can be used towards the purchase of supports to help alleviate stress. And so this might include homemaking services, caregiver relief supports, counseling services, any other services that will support the family functioning. Additionally, I mentioned that we have put into place some additional interim policy parameters just to increase flexibility. And so some of these exist across a variety of different components. For example, families with children in care on special needs agreements or voluntary care agreements will not have to make monthly maintenance payments for the duration of the pandemic period. Additionally, with eligibility and access to the at-home program medical benefits, we've relaxed the eligibility process, which includes a need for an assessment, an at-home program assessment. And so we've relaxed that and trying to ensure that families that were in the process of having a reassessment will continue to receive those benefits, and ensuring that those families that are in the process of trying to access that, there's a more streamlined process without the reassessment piece. Additionally, we've put some flexibility around autism funding. So we will be allowing families to use up to 35% of their funding to purchase equipment and items that assist in home learning and virtual instruction approaches or coping. Additionally, families can direct their autism funding to access family counseling and therapy services with a qualified provider for all age categories. Typically, this is limited to families with children over 6, but we're suggesting that is a service that can be purchased across all age categories. Additionally, there are some pieces that we have, like with autism funding, we've tried to support families knowing that it's very difficult at this point to access clinicians to sign off on authorizations related to justifying the purchase of equipment. So we've relaxed that and confirmed that families themselves who are the signatories on the autism agreement can go ahead and sign those off directly. All of these supports, in addition to that, we've relaxed some of the parameters around respite funding and how that can be used. Typically, there are some specific ways in which families are to use that respite funding. And so during this period, we're trying to offer as much flexibility and really encouraging families to connect with their children and youth with special needs worker, the CYSN worker, to be able to understand sort of how what sort of approaches can be used to enable a break for families. And we've tried to include that this could be a range of opportunities or possible options, knowing that the purchasing or access to a respite provider may be difficult. And so maybe being able to utilize that for homemaker supports, meal prep supports, counseling supports, those types of things. We've tried to offer some greater flexibility around it.
Great. Thank you, Katie. We do have a few questions that have been coming in, so I'm going to go ahead and turn back to answering those. Thank you so much. The next question is was from Lappe Nation. My question is around funding that was given to DAA. What is the purpose of this funding, and can this funding flow through to the nations that the delegated Aboriginal agency provides service to? Lappe Nation is still under the delegated agency, but we're working towards its own jurisdiction.
I think that's for Catherine.
Yeah, it's Catherine. Why don't I start with that? So Lake Babine has been given funding, both emergency advances for social assistance and under the emergency management program at the end of last fiscal year, as well as I mentioned earlier, you should be getting your allocation under the Indigenous Community Support Fund to support Lake Babine with readiness and resilience at a community level to address this pandemic. We have not given additional funding to DAAs per se. All DAAs in BC are smaller and therefore are funded on a needs basis based on their annual work plans. What we have indicated is if there are COVID-19 related expenses, right, needing to put in new procedures and protocols and having equipment and changing the way they're doing things or providing things to kids such as laptops so that they can connect with their family in the absence of in-person visitation, those kind of additional expenses either in the operations of the DAAs or to directly support the kids in care and families. Those are expenses that we will cover during this, but it's not that we've had an allocation that we've provided to each DAA specific to COVID-19. I would also say, as I mentioned on the onset, that we are committed to continuing to move forward on those jurisdiction discussions. So I believe they in fact are still continuing with Lake Babine, but certainly we are willing and able, as is MCFD, to continue to have those conversations to advance the jurisdiction negotiations.
Thank you, Catherine. The next question is also for ISK. What is the support for MH services for a number of challenged youth in our communities? A lot of our youth and some adults are out and about with no controls, and to keep our elders safe, there is a way to house off reserve. Is there a way to house off reserve? Sorry. So as mentioned earlier, the First Nations Health Authority is the lead on any health and mental health related issues. So I would suggest you connect with FNHA in terms of what additional supports they might have for mental health. As I mentioned earlier as well, they have asked communities for plans around dealing with isolation and quarantine. That doesn't necessarily mean in this case, I think you're talking about, you know, can you remove people from the community and provide them with other housing during this period. It is specific to isolating or quarantining individuals who might have COVID-19. But I would suggest on those related questions that you engage either with, you know, the regional offices of FNHA or through Shannon McDonald's office here in Vancouver. Thank you. The next question is for MCFD. What can your programs do to support visitation rights for children in care?
Okay, and I'm going to ask Joanne White to talk about that.
Hi, thanks very much for the question. So we are actively working and wanting to work with family and extended family to support and maintain connections and visitations for children and youth in care. There's been extensive work done in preparation to Corey's earlier comments about needing to move to virtual visitation from in-person for this time period, and also subject to the circumstances of exception. We've done work with our staff to position them to know how to utilize virtual platforms so that they can work with caregivers and parents and set those visits up. There's also work underway to see about assistance for devices to support virtual visitation for children and youth in care, either for the children and youth in care, depending on their age, or their care providers, so that we're able to maintain those important and significant connections, especially right now.
Thank you so much, Joanne. The next question is, with emergency services due to the pandemic, does MCFD no longer have to call local bands when dealing with at-risk youth?
Karen Blackman, I think we wanted you to take a crack at that first, and then we'll pitch it over to Sam. Go ahead, Karen.
Hi. I don't think there's any change in the need to call local bands when dealing with high-risk youth. We would expect our staff to be following local agreements on phoning the community, and whatever the local understanding is would remain the same.
Thanks. Sam, anything to add on that?
No, just to say that it would be the same for any delegated agencies too. The expectation is they still connect with the band in the same way.
Great, thank you.
Thank you so much. The next question is, in regard to these changes with autism, where do families access all the changes, information on all the changes?
Great, Danielle, over to you.
Yeah, so you can access information on our ministry website under the COVID measures section of the website. As well, families are able to connect with the Autism Funding program or the Autism Information BC call line. So there's a couple ways to access that information.
Thank you, Danielle. We just have some general thank yous to all of our panelists for being here and answering all the questions from Dawn. So thank you so much for your thank yous. We appreciate it. We don't have any other additional questions again in the queue. I wonder if I can call on Cheryl Casimer, considering all her work on this file. If there's any other questions maybe that have been submitted to you over the past couple of weeks during this time that you'd like to share as well. Hi, Cheryl.
Hi. Oh, wow, that's an open-ended question, because we've been having numerous conference calls and Zoom virtual meetings with a number of agencies, as I mentioned in the beginning. So I wouldn't be able to really just kind of summarize those at this time. But I think that moving forward, we will definitely be continuing to have open communication with MCFD and ISC on these matters, well, on all matters going forward. So if there's anything that people feel that they didn't receive information, I know that MCFD has provided Allison's contact information. We also, as a leadership council, have a website specific to emergency response on COVID. So I believe it's www.fnlc.ca. So there's information and links there to all kinds of information that comes to us from ISC, other ministries. And FNHA. So FNHA also has a website, and they are providing tons of information for communities to be able to draw down on information to do preparedness and things like that for communities. So that's also another tool, a useful tool. And we will continue to lobby and advocate, as I've mentioned earlier, on these issues related to child welfare, child and family well-being. And so, you know, if there's the need or the necessity for further webinars such as this on the issue of child and family, we're prepared to look at coordinating that again. And we're just asking that, you know, everybody stay the course. We know that it's really a challenging time that we're in, particularly when we're providing supports and programs to families, and we're not able to do one-on-one with families at this time. So we really need to be innovative in terms of how we continue to provide those supports to them, and that the Leadership Council, in partnership with the in partnership with the province and ISK, we are here as well to continue to provide supports for those nations that are continuing to work towards drawing down their jurisdiction or breathing life into their jurisdiction related to C-92. We know that that work doesn't necessarily stop in terms of wanting to take that next step. And so we're available to support you in any way as well around that matter. But I guess in closing, you know, I just thank everybody for participating during this call. Thank you for the questions. I did take a number of notes, and when we come together again as a Leadership Council to do a debrief, we'll definitely take into consideration some of the recommendations that were put forward in your questions. So thank you again.
Thank you. There is one additional comment in the group chat. And I'm going to just pose this to both the province and ISK, but summarizing funds available or supports available in regard to community well-being, just in general, child and family services, if that could be provided and shared on a website, just a high overview of what's available.
So we provided some of the stuff associated with the pandemic. There's lots and lots available, so we can point folks to where you can find that on our website. That's probably the easiest thing. I don't know whether, Catherine, from ISK perspective, you have a easy answer to that.
Sure, thanks for that. I mean, if we're talking about sort of broader supports for at large, we actually have the First Nations Public Service Secretariat housing the updates that I send out to every chief every day, as well as other products that we have and links to other websites. I mean, I think what's challenging in summarizing it is there's a whole series of things that are targeted at individuals who maybe have had their livelihoods affected by this. Then there's support to communities. And I mentioned that we've been sending out allocations this week. We'll be processing the amendments for the Indigenous Community Support Funding, which is flexible funding provided to communities to deal with resilience and preparedness. We also sent advances on social assistance to mirror the provincial changes that are occurring. And we sent advances on emergency management at the end of last fiscal year as well. But I would suggest that some of the sites that I've referenced would have more detailed information. I would also say, as it relates to specifically to child and family services, as I mentioned at the onset, if the Ministry of Child and Family Development is incurring costs on behalf of kids from your communities as they provide the services related to COVID-19, we will cover those costs, as we will for the delegated Aboriginal agencies, since we want to ensure the health and safety of kids during this situation. And I thank everyone for joining us on this call this afternoon. I think it's useful to keep the dialogue open. And I hope just in general that if you guys have any questions, that you feel free to either reach out to myself or to others in our office. We have a COVID specific email that we've set up that is monitored 7 days a week. From 7 in the morning till 7 at night, including Easter weekend. And we've got a dedicated phone line as well to ensure that we are responding to communities' questions as quickly as possible. So thank you very much.
Thank you, Catherine, and thank you, Allison, and your whole team, everybody's whole team, for being here and answering questions. I do just want to reiterate that this webinar, it has been recorded. It will be shared on our website at fnps.ca/COVID-19. We are funneling information from other organizations such as ISC, the First Nations Health Authority, the Leadership Council, too, on that site as well. There's a number of other webinars, other town halls that ISC has been putting on. We're happy to support that platform, support them in getting that information out, but also with other First Nations that are just sharing their experience and how they're dealing with COVID-19 in this ever-changing situation that we're in. So it is available on our website. Hopefully by the end of today, we'll have both of them up that we've done today. So Deputy Minister Allison, anything you'd like to add before we close out? So we don't have any other questions.
No, just thank you very much, everyone, for your time, and my colleagues at ISC and First Nation Leadership Council, as well as all of my colleagues from MCFD who showed up on the call. And we've been chatting back and forth. We'll see if we can send to the First Nations Public Service Secretariat some of our links as well, so you can post those and they can be more easily available centrally.
Yes. Happy to do that. We're going to go ahead and close out early. We had scheduled it to go until 2:30, but we'll leave it here. And you have the panelists' contact information and links that will be provided. So thank you all so much for being here. Thank you again to our panelists for answering questions. And we'll see you in the next webinar. Thanks so much. Bye-bye.